Kidney stones, medically known as renal calculi or nephrolithiasis, are solid crystalline deposits that form inside the kidneys. They develop when minerals, salts, and other substances in urine become highly concentrated, leading to crystallization and stone formation. Kidney stones are a common urinary tract condition, affecting millions of people worldwide, and can vary in size from a grain of sand to several centimeters. Causes and risk factors. Kidney stones form when there is an imbalance between substances that promote crystallization and those that prevent it in the urinary tract. Several factors contribute to this imbalance. Dehydration, not drinking enough fluids, is the most significant risk factor. Concentrated urine increases the chances of crystal formation. Dietary habits, diets high in salt, animal protein, or oxalate-rich foods, such as spinach, nuts, and chocolate, can encourage stone formation. Medical conditions, disorders like hyperparathyroidism, urinary tract infections, gout, obesity, and metabolic syndromes can increase the risk. Family and genetic factors, a family history of kidney stones increases the likelihood of developing them. Medications, certain drugs, such as diuretics, antacids with calcium, and anti-seizure medications, can raise the risk of stone formation. Types of kidney stones. Kidney stones can differ in composition, and the type often determines treatment and prevention strategies. Calcium stones, the most common type, usually formed from calcium oxalate. High levels of calcium or oxalate in urine contribute to their formation. Uric acid stones, develop in people with high uric acid levels, often linked to gout, high-protein diets, or dehydration. Struvite stones, usually caused by chronic urinary tract infections. They tend to grow quickly and can become large, sometimes filling the entire kidney. Cystine stones, rare and associated with a genetic disorder called cystinuria, where the kidneys excrete too much cysteine, an amino acid. Symptoms. While small kidney stones may pass unnoticed, larger stones can cause significant discomfort. Symptoms usually appear when a stone moves into the ureter, the tube connecting the kidney to the bladder. Common symptoms include severe pain in the side, back, or lower abdomen, renal colic, pain that radiates to the groin or lower belly, blood in urine, hematuria, frequent urge to urinate or painful urination, nausea and vomiting due to pain, cloudy or foul-smelling urine if infection is present, restlessness and difficulty finding a comfortable position during pain episodes. Diagnosis. Doctors use several methods to diagnose kidney stones. Medical history and physical examination, identifying risk factors and typical symptoms. Urine tests, detecting crystals, blood, or infection. Blood tests, measuring calcium, uric acid, or kidney function. Imaging studies, CT scans are the most effective for detecting stones, but ultrasound and X-rays are also commonly used. Treatment options. Treatment depends on the size, type, and location of the stone, as well as the severity of symptoms. Small stones, often pass naturally with increased water intake, pain relievers, and medications that relax the ureter, such as alpha blockers. Large stones or complications, may require medical procedures such as extracorporeal shockwave lithotripsy, ESWL, using sound waves to break stones into smaller pieces. Ureteroscopy, insertion of a small scope through the urethra and bladder to remove or break up stones. Percutaneous nephrolithotomy, surgical removal of large or complex stones through a small incision in the back. Medications, depending on stone type, medications may prevent recurrence. For example, allopurinol for uric acid stones or diuretics for calcium stones. Prevention. Prevention plays a key role since kidney stones have a high recurrence rate. Strategies include hydration, drinking at least 2 to 3 liters of water daily to dilute urine. Dietary adjustments, reducing salt, moderating animal protein intake, and limiting oxalate-rich foods. Balanced calcium intake. Contrary to belief, normal dietary calcium helps prevent stones, but excessive supplements may increase risk. Medication management. In some cases, doctors prescribe drugs to regulate calcium, uric acid, or cysteine levels. Healthy lifestyle. Maintaining a balanced weight and controlling chronic conditions like diabetes and hypertension. Complications. If left untreated, kidney stones can lead to serious complications. Urinary tract infections. UTI stones can trap bacteria and cause repeated infections. Kidney damage. Persistent obstruction can reduce kidney function. Sepsis. A severe infection from blocked urine flow can be life-threatening. Conclusion. Kidney stones disease is a painful but manageable condition. Advances in medical imaging, surgical techniques, and preventive care have greatly improved outcomes for patients. While treatment options are effective, the best long-term solution lies in prevention through proper hydration, diet management, and lifestyle changes. With awareness and early intervention, the burden of kidney stones can be significantly reduced, ensuring healthier kidneys and a better quality of life.